Chemo Brain presents as weakened cognitive abilities such as information processing, reaction time, and organization skills. Other areas that are affected are language ability, memory, concentration, and/or attention. Executive functions such as hindsight, foresight, and judgment can also be affected. As chemotherapies become more aggressive and patients are in remission for longer periods of time, the effects of chemobrain have become more apparent as quality of life declines in this population. There's a small population of chemotherapy recipients who still suffer from cognitive deficits 10 years after their last treatment. 50% of women who undergo therapy for breast cancer show symptoms of chemobrain ranging from mild to moderate in their remission time. Most research is pulled from patients who are treated for breast and testicular cancer because these populations have the highest survival rates. Similar cognitive declines are found in patients suffering from HIV/AIDS, hepatitis C, chronic fatigue syndrome, and traumatic brain injuries. Surviving cancer through treatment, then not being able to get back to pre-treatment functioning, is debilitating to patients, and this increases levels of depression and anxiety. Risk factors that could increase the chances of getting chemobrain are having the E4 allele in breast cancer or lymphoma patients, age, as hormone levels decrease, because many premenopausal women experience ovarian failure after receiving chemotherapy, and this number is a whopping 77%. Also, concurrent medications like antiemetics and sedatives that are taken alongside chemotherapy, different types of chemotherapy like cyclophosphamide, methotrexate, and fluorouracil, and then high-dose regimens. 32% of patients who receive high doses develop chemobrain versus 17% of patients who receive low doses. Furthermore, self-reported cognitive deficiencies are more exaggerated than actual tests reveal, but this only makes this population feel like their symptoms aren't valid, so this contributes to the stress and anxiety seen in these populations. There are different hypotheses as to why chemotherapy patients develop chemobrain. So, different hypotheses are that the blood-brain barrier function is compromised, so neurotoxic chemicals enter the brain, causing chemobrain, or cytokine activity disrupts normal hippocampal activity, thus reducing memory abilities. And the last hypothesis is that there's a vascular injury that causes ischemia or infarction in the brain tissue, thus reducing brain function. And then there are a few different options for treatment that have been looked at to treat chemobrain. So the use of erythropoietin, or also known as EPO, manages different symptoms of anemia. So if ischemia in the brain is the cause of chemobrain, then this treatment should be helpful. So far, there are no statistically significant results deeming this treatment effective. Another possibility is methylphenidate, aka Ritalin. So this is prescribed to help with concentration, fatigue, and memory. There have been positive findings with this treatment. There's also hormone replacement therapy. This is mostly used in the female population because decreases in estrogen levels are associated with memory, attention, and psychomotor deficiencies. But then it has also been found that treatment with estrogen could lead to a heightened risk in developing dementia. And also, postmenopausal women should not receive hormone treatment. So this treatment is a bit more controversial and not supported everywhere. Another treatment could be cholinesterase inhibitors to stabilize memory capacity in patients, and this has proven useful in patients with Alzheimer's and vascular dementia, but it has not been used yet in chemobrain patients. And finally, the last treatment that could be used is ginkgo biloba, which is a leaf extract and has been found useful in treating early symptoms of Alzheimer's. It may inhibit the loss of cholinergic receptors, which are important in memory and cognition, and it has membrane stabilizing effects. This treatment shows promise, but it also stimulates blood vessel growth, which could be an issue for cancer patients because it could allow for easier metastasization of certain cancers. That is my presentation. Thank you